Thank you, and thank you all for coming. I get the good part of this talk. I get to tell you about a real success story in medicine, and that's not what we've heard as of late much. But this is a novel concept, and it led to a Nobel Prize. And what the concept was can a viral infection lead to the development of cancer? So what you have to understand about our bodies and our cells is that they are managed by DNA inside the cell. So the cell system, what the original idea was this thing called the two-hit hypothesis. So every cell basically has two alleles that drive that cell, that tell that cell what to do. And what the two-hit hypothesis is that let's say one of those alleles on that cell is damaged. Maybe it was made a little wrong, maybe it was damaged in some way. Our bodies are so incredible that our immune systems can probably clean that cell up, get it out of there, program cell death, or even repair that allele. But the two-hit hypothesis says, what if a second hit happens? What if you go into the environment and maybe you smoke a cigarette or you are introduced to a virus? When both alleles have been damaged, now we lose control of that cell, and that cell becomes cancer. That's kind of how this whole story began. The second part of the story is the discovery of a virus called human papillomavirus. And this gentleman changed the world. In 1973, he was given the Nobel Prize for his work on cervical cancer. And what he proved was that the HPV virus infects women's cells and that those infected cells become cervical cancer. And that was when the story began to change. We began to, Dr. Chan's going to talk about other viruses that we know can do this now. But this was the novel work that started this. What we know is that not every person that's infected with HPV will get cancer. It's a very small group. And then of those HPVs, just like coronavirus, I promised I wouldn't say that today, I'm sorry. But just like coronavirus, it has continued to mutate. Now we know there's over about 90 different viral strains of HPV, but only a subset of those are dangerous and lead to cancer. So then two things began to happen. One was that we realized it wasn't just cervical cancer. So this is the burden of the disease. It's urogenital cancers, and it's now the leading cause of head and neck cancer in men. So what we're learning is that HPV isn't just a women's disease. It's all of our responsibility. And at the same time, the development of the Gardasil vaccine, or the HPV vaccine, started. Now, this vaccine has evolved over time. We're now in its third iteration. It now involves 9 different viral strains, and those 9 are the most virulent, the most cancer-producing, so that we have continued to see this story change a lot. And here's the beauty of it. You can see that if we use the vaccine, you see those cancer rates fall dramatically. But this isn't new news. We've known this for a long time. So the question is, why are we still at about a 30% vaccination rate? And this is where the talk gets a little uncomfortable sometimes. But here's what we know. HPV can be sexually transmitted. That's possible. It can also be transmitted by close contact or touch. It can also be transmitted from mother to child. So the person that is infected with HPV may have had nothing to do with their own exposure. And that connotation that we were vaccinating young women against sexually transmitted diseases was a hard message. And I understand that. I really do. I've got 4 small children myself. And, you know, our target age for this vaccine is 9 to 26. But we really try to get it at the 12-year-old age. And to think about my child having sex when she's 12 makes me want to throw up. But it's probably going to happen in her lifetime. And the analogy I like to use with parent groups is the bike helmet. You know, you don't put the bike helmet on your child when they're driving down the highway on their bike. You don't put it on them after the crash happens. The idea is to put the helmet on when they're in your driveway, and you can talk about risks and benefits. And unfortunately, we have to start those conversations earlier with our children. So if we could get away from thinking about it as a sexually transmitted virus and just think about this as a cancer-preventing vaccine, I think that's where this conversation should go. I think all of us as parents would swim through fire for our kids. So just, if you'll let go of some of it and rethink this as maybe the one way that we can protect our kids from cancer and have those conversations that need to happen. We've now expanded the age range of the vaccine to 45, and that's another interesting conversation. But the truth is, we're living longer, we're active longer, and life is unpredictable. And the fact that you may be co-infected with another HPV later in your life may put you more at risk. So the vaccine's out there, it's available, it's one of our best success stories. I'll be here all morning. I'd love to talk to any of you about it, but I think now it's time to hear about the novel ideas that are coming.